Today, we're going to talk about something that feels like it's straight out of a medical drama. It's a drug that can pull someone back from the edge of a coma in minutes. A true antidote. But like any good story, this one has a pretty dangerous secret lurking just beneath the surface. So let's just start with that big question. Does a real-life antidote for a drug overdose actually exist? You know, the kind of thing you see in movies where they inject someone and they just snap out of it? Well, for one of the most common types of sedatives out there, the answer is, surprisingly, yes. There is a reversing agent. But, and believe me, this is a huge but, using it is a high-stakes gamble with some seriously life-threatening consequences. So let's get into it. Okay, so first up, we need to really understand the problem that this drug was created to solve. And that is the benzodiazepine problem, or what happens when a drug designed to be calming becomes critically dangerous. So you've probably heard of benzodiazepines, or benzos, right? We're talking about really common drugs like Valium or Ativan. And they are incredibly good at what they do, treating anxiety, helping with sedation. But in an overdose, that calming effect just goes way, way too far. It can push someone into a coma, and even more dangerously, it can cause severe respiratory depression, which is just a technical way of saying they stop breathing. This is a true lights and sirens medical emergency. So, with a patient's life on the line, clinicians needed a way to pull them back. And this is where Flumazenil enters the story. Let's call it our hero for now. It is a rapid reversal agent. Now, that's a mouthful. A competitive antagonist. What does that even mean? Well, the easiest way to think of it is like a bouncer for your brain. Its only job is to find where the benzodiazepines are hanging out and just kick them out of their spot so they can't cause that deep sedation anymore. Its brand name is Romazicon, but we're going to stick with its generic name, Flumazenil. And when we say rapid, we mean insanely fast. We're talking 1 to 2 minutes after you push it through an IV. You can literally have a patient who is completely unconscious, not breathing well, and they just start to wake up. It is an absolutely dramatic and sometimes life-saving thing to witness. So, how in the world does this magic actually work? Well, to get that, we need to shrink down and look at the literal battle for control that's happening inside the brain. So before we talk about the battle, you need to know about the battlefield. It's called the GABA-A receptor. The simplest way to picture this is as the brain's main calm-down button. When this button gets pushed, your brain activity slows down. It's what makes you feel relaxed or sleepy. And this right here shows the 3 key players in our drama. Step 1, your brain's own natural calming chemical, GABA, comes along and presses that button. Normal stuff. Step 2, the benzodiazepine shows up. Now, it doesn't press the button itself. Instead, it grabs onto a different spot nearby and acts like a turbocharger, making the calm down button way more sensitive and effective. That's what causes the deep sedation. Then, step 3, in comes Flumazenil. It wants that turbocharger spot way more than the benzo does, so it muscles its way in, physically kicks the benzodiazepine off, and blocks the spot. Just like that, the calm down button goes back to normal. Okay, so Flumazenil sounds pretty perfect, doesn't it? A miracle drug. But this is where our story takes a sharp turn. This is where we find the antidote's critical flaw, the dark side that makes using it so incredibly tricky. The whole problem boils down to a really dangerous mismatch in timing, or what we call a drug's half-life. It's basically how long it sticks around. Take a look. Our antidote, Flumazenil, has a super short effect. It's mostly gone in about an hour. But the sedative it's fighting, like diazepam, that stuff can hang around in the body for 20 to 50 hours. See the problem here? This quote really says it all. The antidote wears off long, long before the overdose drug does. This means a patient who you just woke up can fall right back into that deep sedation, right back into a coma. It's a phenomenon called resedation. The battle is definitely not over just because you won the first round. But honestly, resedation isn't even the biggest worry. The real, terrifying risk is what happens if you give this to someone who is physically dependent on benzodiazepines, someone who's been taking them every day for a long time. If you suddenly rip all those benzo molecules off their brain receptors at once, it's like flipping a switch from ultra calm to maximum panic. It can trigger a violent, acute withdrawal. We're talking severe agitation, a racing heart, dangerously high blood pressure, and the most dangerous complication of all, life-threatening seizures. So with these massive risks, how on earth do doctors decide when or even if they should use this powerful tool? Well, it all comes down to a really high-stakes balancing act. To try and minimize these risks, they don't just slam in a huge dose. The strategy is slow and steady. You give a tiny initial dose, wait a minute, and just watch the patient, see what happens. If you need more, you'll give another tiny dose, and then another, carefully adding just enough to reverse the dangerous effects without sending their whole system into shock. The goal is to wake them up just enough, not trigger a catastrophe. And there are absolutely situations where the risk is just too high, where it's a hard no. We call these contraindications. For example, if a patient is taking benzodiazepines to control a seizure disorder, you absolutely do not give Flumazenil because you could trigger nonstop seizures. Or if someone has also overdosed on certain old-school antidepressants, the benzos are actually protecting them from seizures. Reversing them would be a disaster. In these cases, the antidote is actually more dangerous than the problem it's supposed to fix. And that brings us to the single most important point. Flumazenil is not a magic bullet. It's not a substitute for real medical care. The actual life-saving treatment for an overdose is supportive care, making sure the patient has a clear airway, making sure they're breathing. Flumazenil is just a tool, an adjunct to that care, that can sometimes be helpful in very specific, very carefully chosen situations. Which brings us right back to our big question. Is Flumazenil a life-saving hero or a high-stakes gamble? And the truth, as it so often is in medicine, is that it's both. In the right hands, for the right patient, it can be a miracle. But in the wrong situation, it can be a disaster. And that's what makes the story of this antidote so incredibly compelling.